I'd like to kick things off with a discussion on the correlation between pollution and COVID-19 with my esteemed panelists. Joining me today is Commissioner Mitchell Silver of the New York City Department of Parks and Recreation. We also have Jacqui Patterson, Senior Director of the Environmental and Climate Justice Program at the NAACP. And we have Dr. Ingrid Waldron, Professor in the Faculty of Health at Dalhousie University. Welcome. Glad to have you all here. So let's start with you, Dr. Waldron. What kind of statistics and data are you seeing in terms of the correlation between COVID-19 and climate change impacts, particularly for Black people and people of color?
Well, when the pandemic hit earlier this year, what we were seeing in the United States was that racialized communities, Black, Brown, Indigenous communities were disproportionately impacted. So that's clear in the United States. In Canada, where I'm from, there are certain areas, specifically Toronto and Montreal, where we are seeing similar patterns. And that's something that we were concerned about. There have been a number of reasons why this is happening. These are communities that tend to be closer to polluting industries. And communities that are closer to polluting industries have particular health issues, environmental health issues. There are also communities that are working in essential services jobs, are lower income, suffering from higher rates of poverty. And these are also communities that tend to live in multi-generational households, which makes it very difficult to engage in physical distancing. So for all of those reasons, Black, Brown, Indigenous communities tend to be disproportionately impacted by COVID and other health issues.
And Jacqui, you've been doing this work for a long time. I'm sure that these disparities that are becoming more exposed due to COVID-19 are of little surprise to you, given your work with environmental justice and fence line communities. Can you kind of talk about the transformative reconstructive surgery that we talked about earlier that you feel needs to happen in order for systems to be more responsive to these disparities?
Thank you so much. Yeah, I was on a panel recently with Mayor Steve Benjamin of Columbia, South Carolina, and he said that COVID-19 has acted as a X-ray to expose the broken bones of American society and systems. And this is where the reference to the reconstructive surgery is needed, and not reconstructing it back the way it was, but really transforming it to what it actually should be. Because we have the situation where the socioeconomic and political conditions are what led to the vulnerabilities that resulted in this kind of pattern of disparity. And so whether it's the ways that we historically have designed our housing systems with redlining resulting in segregation, the ways that we today distribute resources in terms of higher property values means better resources and services. All of that combines to make communities more vulnerable. So we need to reconstruct how we're such a profit-driven, finance-focused society to one that actually uplifts human rights in terms of the way we structure our systems. And so, for example, instead of having where the quality of our education is dependent on our property values, instead of having it so that the extent to which we have stormwater management systems is dependent on our property values. The fact that we have the vestiges of redlining still exist today in terms of certain communities resulting in the disproportionate exposure to toxic facilities, and the fact that our political system is tied in such a way to the interest of big money, in this case fossil fuel industries, so that the regulations for the pollution that is making us more vulnerable to these pollution impacts are so paltry that they actually don't protect community. They aren't serving their function. So those are just a few examples of the type of transformation that we actually need to have a society that uplifts all rights for all people.
Great. And Commissioner Silver, you as the Commissioner for New York City's Parks and Rec program, and you've been involved in some of your own reconstruction there with your trees program and helping to expand the urban tree canopy in New York City. Can you kind of talk about that program and how it helps address some of the equity issues that we're talking about today?
Sure. So there's been really a commitment in New York City. We're a city that does believe in climate change, and we do understand the impact of heat as the planet gets warmer. And we launched this campaign for 1 million trees that was under Bloomberg, that was continued under the current mayor. We actually planted that 10-year campaign in 8 years, 1 million trees added to New York City. But we also were focused on other neighborhoods. We have this cool neighborhood initiative. We understand the value of having a strong tree canopy for air quality, for water quality, but also to address some of the heat island effects. And so we went on this initiative called Cool Neighborhoods. We recognized there were many communities, Black and brown, that did not have the quality trees for air, for water quality, and to cool their city. And so we focused particularly using heat maps on those communities that were underserved. We have over 2 million trees in our parks in New York City and close to 700,000 street trees. So the focus was on those neighborhoods, those vulnerable neighborhoods with high heat index. And we went on this campaign to plant many trees. And it was phenomenal how we're able just to cool those streets, add shade, and offer better air quality, because many Black and brown communities near industrial areas suffer from poor air quality due to congestion and traffic. And so that initiative is underway, and we continue to ensure we address climate change by having a very, very healthy tree canopy. This initiative has now gone global.
And Jacqui, Commissioner Silver is kind of speaking to how, although these problems are kind of global in nature, this is an example of a local solution to at least address the issues locally where they stand. Can you also talk about how local utility infrastructure is also a good starting point for kind of helping to deal with equity and infrastructure issues related to both the pandemic and the climate change?
Yeah, thank you. So one of the transformations that are needed is to actually shift us from an energy system that has as its principal goal to generate profits for a wealthy few versus to actually provide energy, which as its primary goal. And so we have the situation where we have utility companies where coal companies, for example, that provide the bulk of our energy, where the CEO pay on average is $9.8 million a year in compensation. And then you have situations where people have a hard time, fall behind on their electricity. And as we talked about in our Lights Out in the Cold report, they fall behind on their electricity bills or their oil and gas bills for heating, and they end up having their utilities shut off for non-payment. And while someone is literally making money to an extent that it wouldn't even be worth their time to pick up a $5 bill if they dropped it on the ground, we have people who are living hand to mouth and have their utilities shut off, and they use a candle to light their home and burn down their homes, or they use a space heater if their oil and gas has been cut off and burn down their homes, or they get cut off and they're dependent on a respirator, and they end up losing their lives because when their electricity gets cut off, that respirator is needed for them to breathe, as it happened to a grandmother in New Jersey in 2018. So the stories are really too many, and it really kind of shows that if in a world where we have the resources we need through solar, through wind, through natural sources of regeneration that don't pollute our communities, we can actually transition to a system where it's a public sector driven system. So again, the goal is to provide this much needed resource for all, and where we don't have the profit margin where someone actually benefits from cutting someone off from a necessary resource for life. So what we really are pushing for is to shift away from an investor-owned utility model to one that is a public sector owned, and to the extent that there's private sector ownership, that is actually community ownership models, or rooftop where individuals can own their own mini solar systems or whatever, but so that we actually remove the profit margin that has actually resulted in the death, where people are paying the price of poverty with their very lives. Thank you.
Wow. And Dr. Waldron, you're based in Canada. So much of what we're talking about in terms of fashioning solutions is based on data, like just having the basic numbers in terms of racial data and which populations are most vulnerable to these pandemics and these issues. Can you kind of talk about some of the challenges in Canada presented based off of collecting racial data and how that ends up impacting the kinds of solutions and policies and laws that are created for Canadians?
Well, I think Americans would probably be surprised to know that we do not collect disaggregated race-based data in Canada federally. So that is a real hurdle for us in terms of addressing all of these issues, because if you don't know what's happening, it's very difficult to fix it. So when we talk about public infrastructure and climate change and environmental racism, these are health issues. COVID obviously is a health issue, but in Canada, there is not currently a push by the federal government to collect this information to find out how the social determinants of health, including racism, contributes to exposure or risk for COVID or for other health issues. So that's been a challenge for me as a researcher, as an academic, but also for those who are in policy or who are health professionals, because we often have to rely on data from the United States. And while there are similarities, we have our distinct issues. In Canada, for example, in Nova Scotia, the Black communities are disproportionately in rural areas, not in urban areas. 98% of the Black communities are in rural areas. So even looking at the intersection of race and income and living in a rural area has its own unique hurdles or challenges, but it's very difficult for us to address some of those challenges without that data.
And Commissioner Silver, you also have a background in planning. Can you kind of talk about how crucial having that kind of data, how critical it is to have that kind of data for planning purposes, urban planning purposes, when you're trying to craft these policies to address inequities?
It absolutely is critical. It serves as a diagnostic, and any physician knows that you have to conduct those diagnostics to see the vital signs, to understand what has to be addressed. We took this data-driven approach in New York City when the mayor brought me here, very concerned about equity, and so we took a data-driven approach to find out how equitable we've been with our park system. We all know how important parks and open space are, not just for physical health, but for mental health, and that's more so during COVID. We did that analysis. We looked at 20 years of investment of New York City. New York City invested over $6 billion in park improvements over 20 years, and that's multiple mayors. But when I came commissioner, we wanted to find out, was it equitable? Did every neighborhood receive that investment? We did analysis, looked back 20 years, and uncovered over that $6 billion, over 200 parks, we have about 2,000, they were left behind, and they happened to be in Black and brown communities. Mayor de Blasio, to his credit, invested over $300 million along with city council money to rectify that issue. But it was the data that uncovered this disparity. To date, we now targeted 67 parks to recreate. We've done 50 of the 67. And I have to say, many of these are located in Black and brown communities. And it's been a savior that now people have access to that quality public space that they didn't before. We broke up the asphalt. Now it's a lot more green, stormwater retention. And we tell people that if you just go to a park for 20 minutes, particularly during COVID, reduces stress, reduces anxiety, builds the immune system, and every neighborhood should have a quality park. And I'm so pleased this equity initiative has now created fairness in our park system where everyone can now benefit from green public space, particularly during our crisis and pandemic of COVID.
Now, Jacqui, ever since racial justice has become kind of front and center in the American, if not global, conversation, given what we've seen with police brutality, climate justice, and even this COVID-19 pandemic. Uh, we talked about how a lot of corporations have wanted to contribute to organizations that are fighting racial injustice, and the NAACP that you work with has been targeted by a lot of corporations who want to get involved and who want to help. But you talked about how, with us earlier, how that kind of contribution can't just be a thing of just throwing money at it, right? How there has to be some kind of alignment involved. Can you go further and explain for our listeners what what you mean by that kind of alignment in terms of helping with the problem?
Yeah, sure. Thank you. So, an example is one of the major contributors to the pollution in a small area in Texas was wanted to give money to the NAACP and at the same time continue to pollute those communities and instead of kind of investing that money into improving one's operation so that one doesn't continue to pollute the communities, then there's kind of a desire to showboat in a way and make a statement about racial justice and then provide money to an organization that engages around racial justice while continuing with business as usual. And so we are really, as the Environmental and Climate Justice Program and as the NAACP, calling on these entities to do better in terms of their corporate practices. First and foremost, as that their statements need to be backed up with actual transformation in terms of how they actually do business. So that's just one example of way too many. There's different organizations, whether it's the continued polluting practices or violations of labor rights. There's even in some of the positive industries like the solar industry, we're calling on the solar industry to say, okay, great that you want to engage more with our communities, and there needs to be a opening and support of unions. There's been a history of union busting with some of the solar companies. And so even with folks who aren't necessarily doing polluting on one side, on another side, they're not necessarily being in line with the types of the full suite of rights that we are upholding as a civil rights organization.
And so we have a question from the audience. I'm just going to pose it. Any of you can take it, but I want to kind of let you all know up front that we have about 2 minutes left in our session. But the question from the audience is can we talk about the intersection of environmental justice and homelessness? As the weather gets colder, COVID cases climb up again, and the number of homeless are expected to rise. And I'm going to add to the question, if you all can address it, how can the private sector also address, or should they address these issues of homelessness as they spike with COVID?
Well, let me
I can say that
Let's start with Dr. Waldron.
Homelessness is a social determinant of health, right? Similar to poverty, they're all intersecting issues. And COVID-19 is very much tied to homelessness because these are individuals who are dealing with housing insecurity in many ways and would find it difficult to practice social distancing. But also the cold weather means that they're going to be vulnerable to illnesses, which would, of course, compromise their immune system. So that makes them more vulnerable to COVID-19. So when we look at issues like the social determinants of health and housing insecurity and patterns, residential patterns and housing patterns, COVID is very much tied to that. And it's also tied to income insecurity, and it's tied to food insecurity. None of these issues are independent issues. They are intersecting issues, which reveals to us that we can't dismantle or address any of these issues unless we address structural racism within all our systems. Because I think what we're saying today is that everything is connected. So the kind of moral of the story is that we first need to address structural forms of racism within labor, within criminal justice, etc., in order to address health disparities.
What I was going to add, and I thank Dr. Waldron for her response, is that here practically in New York City, we have compassion for our homeless population. And the mayor very early on wanted to make sure that they were vulnerable to COVID. We started moving a lot of our homeless populations into hotels. It is controversial, but wanted to make sure they had both the homeless services, the mental health services. In the Parks Department, we partner with the homeless services. We have a park enforcement patrol and law enforcement, NYPD, to go into our parks because we have seen an increase of people in our parks to make sure they get the proper services. So from a practical point of view, particularly with the weather getting colder, we want to make sure we can help get them off the street, get the mental health services, the other health services. But the biggest move is really looking at a lot of our hotels, which are seeing very, very low occupancy, and making sure it's an opportunity for those that do not have a home to have a place and hopefully be connected to services and ultimately back on the road to recovery.
I'll just also chime in that on the kind of transformational continuum, as we provide kind of the stopgap measures of making sure that folks are immediately out of harm's way, then we launched this initiative called the Transformational Climate Finance, where we're looking at dealing with issues around housing insecurity, where we bridge the stopgap measures with long-term land and housing ownership measures. And so one of the things that we've been talking about with some of the social impact investors is whether the extent to which we can go from, for example, a shelter or a hotel situation to then a tiny homes kind of manufacturing and having folks in tiny homes that they would own, and then they would begin to build up equity to get into the type of housing that they would actually like. And so keeping in mind that we need to keep that separation with COVID-19, and we can't have people housed in shelters and so forth, but that there's a progression from the stopgap measure to the long-term solution that's also supplemented with the types of services people need around, whether it's mental health or the types of case management services. So really, but making sure that it's always on a trajectory towards long-term security and local and self-determination. Thank you.